I remember smoking pot with my mom when I was 12, all the way up into 15, 16, I started drinking, partying with friends. When I spent my week in jail, I mean, that was my lowest of my low. I mean, I really sat and actually thought about everything I'd done, how I hurt my kids, how I hurt my family. And I stayed clean for 9 months. I was pregnant with her because me and the kid's dad was still kind of talking, and then we got into a big, huge fight, and we kind of quit talking, and then that's kind of when I fell off the wagon and relapsed being pregnant with her. And like I said, then that led me to coming here. I was still using though, and was kind of just one of those situations of them telling me, you need to go do this.
NAS is neonatal abstinence syndrome. It is what happens when a mother takes opioids during pregnancy, and the baby gets dependent on those opioids just like an adult would. So when the baby is born, the baby has to withdraw exactly like adults do. It's a very painful withdrawal. We don't exactly know the long-term effects of neonatal abstinence syndrome. We just know that it is a devastating thing for a baby to be born with symptoms like this.
You know, our community here in Knoxville needs to address this issue because we're the epicenter for the opioid epidemic in the state of Tennessee. Frankly, the Appalachian Mountain chain is the epicenter in our country. You've got a 55% more likelihood of having an overdose death in Appalachia than any other place in our country. And that's just astounding when you start thinking about East Tennessee, you know, a place where we like to call home and that we have got lots of amenities. But it's a real problem, and that's needs real solutions, and that's one of the things we want to be a part of in the community.
It takes all of us working together to really see these bigger, more tough issues get resolved in our community. But I'm extremely hopeful that we're making a lot of great progress, and we're going to continue to do so.
United Way has been an extraordinarily helpful way for us to maintain our programming and to be able to help women. Since we don't charge anything for our mothers, it's very important that we have the support of United Way.
United Way has a strong history and a strong voice in the community that can really help us smaller nonprofits in getting our message out.
It's really a community interpreter of what the community needs in order for it to be healthy, what it needs to thrive, what it needs to be a great place to live.
United Way funds allow us to leverage resources from the state and from federal government that bring resources to the community. And frankly, we benefit from the referral sources that United Way provides. People need to know how to get care, and United Way is a great avenue to start.
My drug use is a disease, and I've got to work my recovery the rest of my life. It's essential for me, my kids, my family. There is help. People do care genuinely, want to see you succeed, and don't want to see you throw your life away. And then, you know, knowing that has really impacted me to do better.